I'm Connie Holler-Martel, for all of you. I think everyone knows me by now. The subject today, though, is why breast cancer patients feel overwhelmed and what holistic practitioners often miss. So this is going to be fairly brief. It's not very long, but I hope to touch on a few things, and maybe you'll walk away with just a little bit of something when we're done. The reality. My name is Connie Holler-Martel, which I just said, certified holistic cancer coach. I am a 4-year cancer survivor as well. Thank you. Certified health coach and also certified in plant-based nutrition. It says pending because I'm in the process of getting that certification, so we're in the works. So next is the reality. A woman is diagnosed with breast cancer. The focus immediately goes to treatment, surgery, chemotherapy, radiation, and medical treatments. But what often gets overlooked in this is she suddenly is responsible for navigating one of the most complex, emotionally charged health challenges and journeys of her life, with little guidance on how to do it. So, the hidden problem, it's not just the diagnosis, it's the overwhelm and the managing it all, which I can attest to. So what overwhelm looks like. Here's what overwhelm actually looks like for her. Information overload. She's Googling everything, hearing different opinions. She doesn't know who to trust. Decision fatigue. You've got treatment decisions, nutrition, supplements, lifestyle changes. Everything feels urgent and important. So moving on to the next is fear and urgency. She feels like if she makes the wrong choice, it could actually cost her life. Emotional isolation. Even with support, no one fully understands what she's carrying. And here's the part that's even harder to hear. Even holistic support, when not delivered thoughtfully, can add to the overwhelm. The breaking point is trying to do it all equals burnout. Even support can feel like pressure. So the next is my story. In my work as a holistic cancer coach, I know how they are feeling. My research often led me to long lists of things to change. Things like cut this out, add this in, try this supplement, follow this protocol. And instead of feeling empowered, I felt like I was failing. Because I didn't have the capacity to do it all, that's when I realized something really important. And it's not that I wasn't willing, it's that I was overwhelmed. What practitioners miss, too many recommendations, too much too fast, not meeting her where she is, and helpful can still feel like overwhelm. So imagine this instead. Instead of confusion, she feels clear. Instead of pressure, she feels supported. Instead of doing everything, she knows exactly what matters most. She's still going through treatment, but she feels more control, more grounded, more confident in her choices. She's no longer just reacting, she's actually participating in her healing. How do we get there? This is a shift. So shift number 1, we simplify. Instead of giving her everything all at once, we prioritize. What are the 1 or 2 things that make the biggest impact for her right now? Shift number 2, meet her where she is. A newly diagnosed woman has very different needs than someone who's in survivorship. We also ask, what does she actually have the capacity for in this moment? And then 3, support. She doesn't need everything perfectly. She needs support with managing her side effects, building the strength and resilience, creating small, sustainable changes. This is exactly work that I do. I help women cut through the noise, create a simple and personalized plan, feel supported instead of overwhelmed, because healing doesn't come from doing more. It comes from doing what matters most. So less information, more integration. Prioritize, implement, and breathe again. breathing is very important. So, when you reduce overwhelm, you change the healing experience or her healing experience. But here's what I'd like to do is invite you all. The next time you learn about a cancer patient, pause before giving recommendations and ask yourself, am I helping her feel clearer or am I adding to the overwhelm? And then simplify what you offer. Prioritize what matters, support her capacity, and not just her condition. You change the entire experience of the healing. And if you'd like to learn how to better support your breast cancer clients in a more simplified, effective way, I'd love to connect with you. So thank you.